everyone. Welcome to the Midlife Wellness MP podcast. I'm Kim Heifner, a board-certified family nurse practitioner, menopause specialist, and host of this podcast. So welcome. Well, in a world where health challenges often seem insurmountable, one physician is revolutionizing the approach to wellness. By combining cutting-edge science with a deep understanding of the body's natural healing processes, she is empowering individuals to take control of their health and unlock their full potential. Meet the visionary behind this transformative approach to medicine, Dr. Jessie Heymeyer, the physician and founder of Well Empowered. Welcome, Dr. Heymeyer, to the podcast.
Thank you so much. It's a pleasure to be here with you and your community, Kim.
Yeah, happy to have you. Looking forward to touching on some things all the way from weight loss to cholesterol and dietary strategies. So a lot of ground to cover. I thought we would just start with this concept, mastering your middle ground, and how it helps people move away from that all or nothing approach to health and weight loss.
Yeah, absolutely. So I think it would be helpful to step back and bring to light the paradigm we've inherited in this area of weight in our body. And this paradigm is one that is typically categorized as an all or nothing approach. And all or nothing being lived as deprivation or overindulgence as the two options. Now, the thing about that is, in either of those instances, deprivation or overindulgence, they are both an expression of self-aggression. And they're just not working, right? They're not working in being effective ways of approaching people's relationships with food and their body, and ultimately really just arriving at a weight where they feel their best, look their best, and they can be their best, right? And so, one of the foundational aspects of when I work with people who are committed to mastering their weight and mastering their relationship with their body and food is we put that inherited paradigm in the past and we embark on a journey I call mastering your middle ground. And mastering your middle ground is really born of self-love. It is a paradigm that is an expression of self-love. And it involves, being guided in this process of moving forward and caring for your body in a way that is self-honoring and sustainable, right? And it's such a joy for me, Kim, when I'm working with people and, I can hear that light bulb going on when people say something like, these things that I never thought I could do, they're easy now. And I wouldn't not do them because I feel so well. I feel so good, physically, mentally, emotionally, spiritually, all of it. Right. And that's really what's available when we let go of the old inherited paradigm and step into a new one.
That's really great. I mean, it's true. I always think of it like taking care of your body, like it's somebody you love, and doing for your own body like you would do for somebody that you care about, right?
Yeah, absolutely. Absolutely.
Yeah. That's great. Well, I also want to touch on, there's been a lot of buzz about natural Ozempic, and I would love to have your professional opinion on these claims. I mean, is there truly a natural equivalent to the drug Ozempic?
So yes and no. Don't you love those answers? So no, there's not one, right?
Okay.
And there are a combination of natural solutions that really do tap into the different ways these, medications, these GLP-1 agonists work. So it's helpful to step back and kind of look at okay, how do they work? And admittedly, there are some ways they don't work that we're not really even sure about, but some of the ways they work, we do know, right? So one of them is that they slow the emptying of your stomach. A second way they work that we're aware of is that they increase your satiety hormones, right? They allow people to experience a sense of, I've been fed, I don't need any more, right? They also, in tandem with that, decrease hunger hormones. And then fourthly, they stabilize blood sugar. So all of this together, there's real synergy in all of these different ways they work together. But we can go through each of these and kind of get curious about like, okay, great. So let's talk about slowing stomach emptying. What might we use that's natural that would also do that? Well, fiber. Fiber is a fabulous way to slow stomach emptying. And, to say a little bit more about like, what is the magic in slowing stomach emptying? I think it's always helpful to really understand how the body works. So,
Oh, for sure.
right. And so
Yeah.
why it's helpful to slow stomach emptying is that in our stomach, we have these receptors, these nerves that sense when our stomach is stretched. And when they sense the stomach is stretched, they actually begin a relay of communication to the brain that is saying, you've been fed, right? So you're starting to engage the satiety mechanisms, which are multiple. But that's why, keeping food, so to speak, in your stomach for longer is a benefit as it pertains to hunger. And, if we go down to the next way they work is, and looking at increasing our production of satiety hormones. I think about, for example, one of the satiety hormones, there are multiple satiety hormones, but if we think about leptin or we think about CCK, which is cholecystokinin, for that second one, cholecystokinin, how we actually produce it is when we consume fats. And so if we were to go back a couple of decades and, visit that fat-free era, it was like, and by the way, I was very sadly part of it, right? It was before I knew better, right?
Right.
But I was hungry all the time. And it's like, well, yeah, no wonder. I was never cueing in this awesome satiety hormone. Fiber also cues in satiety hormones. So, we've got a double win with that fiber. If we move on to decreasing hunger hormones, we can do that with our vitamin D. We can do that through keeping our blood sugar levels stable. We can do that with omega-3 rich supplements or omega-3 rich foods for that matter, right? Things like low mercury, high omega-3 fish or seafood, salmon, Arctic char, sardines, shrimp. Those are all examples of foods rich in omega-3s that will help dampen the hunger hormones. And then, lastly, we have stabilizing our blood sugar and how we can stabilize our blood sugar. I mean, we've got so many great tools for that, right? If we just think about the way we're eating and combining, making sure we have enough protein and we're not getting too heavy handed with our simple carbs or sugars, right there, that's going to go a long way. On the supplement front, we could bring in something like berberine or chromium. But collectively, with all of these, we absolutely have some fabulous points of leverage for supporting people so that they feel satiated, so that their physiology is working in their advantage rather than feeling like they're swimming upstream against it.
Right. That's awesome. Just putting that together. That's great. When you touch on berberine, I really do like berberine. Let me ask you this. Could you just explain a little bit about how you use berberine, like, and how it compares to metformin in studies and why it might be a good first choice? And my question is, some of the research says to take it before food, with food, after food. And does that matter? And how much do you typically recommend if you were using something like berberine?
Yeah, well, so firstly, when I use berberine, Kim, I'm going to be going on information beyond symptoms, right? So if someone comes to me and they say, I just want to lose 5-10 pounds, I'm probably not going to reach for berberine. It probably won't be necessary and also could create a hypoglycemic effect, right? It will actually bring the blood sugar too low. So when I will use it is when I test someone's fasting insulin and it's in a sub optimal range. Now, the thing about that is suboptimal is very, very different than lab normal, right? Lab normal ranges for insulin can go up to 20, 21, 22,
Mhm.
23. It's like bananas. I
Right.
mean, right. So we want to see, you and I, we want to see insulin at 7 or less,
Mhm.
right? So if you're creeping high end of single digits or certainly in double digits, I'm going to be reaching for berberine. And when I reach for berberine, I will typically dose it at 500 milligrams 3 times a day. I
Mhm.
don't usually see it making a big difference if people take it with or without food.
Okay.
It will have yeah, it will be helpful if they're taking it, if they're having a higher carbohydrate or simple carb or sugary meal. But as a whole, I don't, we're doing so much that I do my best to not get nitpicky when I don't have to. And I find it really is effective either way. And by effective, I mean, people start losing weight and we circle back and we measure fasting insulin and it moves. I mean, it moves
Mhm.
big time.
Mhm. I think it has a good effect on hemoglobin A1C,
A hundred
right?
percent.
And
100%.
cholesterol level.
Yes, exactly. You got it, Kim. It hits. I mean, it's like it's a loss leader. It does so many great things, right?
Yeah.
It's yeah, for someone whose cholesterol is creeping up and they want to do what they can to avoid statins, or even I work with people who they are on statins and their
Mhm.
cholesterol is not looking so hot. It's like, okay,
Yeah.
well, let's layer this in, and it's one of many things that will make a difference. Also, I would say is I don't know if you've played around at all with akkermansia, but
I kinda love
akkermansia,
it. Yeah.
yes, I
I
have
wasn't
been
sure.
amazed.
Really? Okay, that's good to know because
Yes.
I wasn't sure. You hear about, this all this wonderful stuff, and then you hear, no, that's all hype. It's not really that great. So yeah, I would love your experience with it and how to
Totally.
use it.
Yeah, I feel the same way. I initially, when I heard about it, I was like, okay, come on. One bacteria, really? Like, I mean, when we've got all these, we've got so many different types of bacteria that are of benefit. How could it really be that this one specific strain makes such a difference? But I will tell you, I don't use it all the time. Just like just we're using things in a targeted way for the person in front of us. But
Mhm.
I have found when I layer it in, I see the biggest impact on insulin and hemoglobin A1C. And so for someone who's really, out of range, or I'm thinking of a woman who she was on metformin and her hemoglobin A1C was still at like 6.5, 6.7. We brought in berberine and akkermansia. She's now reduced her dose of metformin. It's just like it makes it really does make a huge difference in a way that I never would have imagined. And I'll
Wow.
really just use one a day. I typically,
Okay.
there are a few different brands, and I don't have any affiliation with any of these brands.
Yeah, I was gonna
But
ask you that.
yeah, and there are a few different brands that I've used. There's one that has some EGCG in it, the active constituent in green tea.
Yeah.
And I want to say that is I believe that's by Metabolic Maintenance.
Okay.
I can definitely pause here and look it up in a moment if we want to, but I
Okay.
believe that's what it's called, who makes it. But
Okay.
and then Pendulum, they were kind of
Yeah.
the leaders in bringing akkermansia to the limelight with its impact around, all things related to blood, diabetes, prediabetes, stuff like that. But yeah, this other one that brings in the EGCG, I've been using that a little more regularly.
Well, a question is, one thing that's kind of confusing about probiotics, first of all, there's been a lot of research that definitely plays into your weight. There's different bacteria that are more associated with obesity and thinness, which is totally interesting. And then as women go through menopause, the microbiome changes a lot, even to a composition of a man, which is crazy. Um, so I just feel like it would really be useful for women during these years. But I think the question also is probiotics in general, are they supposed to be taken with food, after food? Does it matter really? When is the best time to take them? Because I get this question all the time. And then when you research it, it tells you all different things. So I'm like, okay. So what are your thoughts?
Yeah, yeah, totally. No, I would say so with probiotics, a few things. Not everybody needs them, right? There was
Okay.
a period where it was like, oh my gosh, everybody needs
Yeah.
probiotics. No, 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 not everybody needs probiotics. And some people do benefit, right?
Right.
So, with that, in the way of when people take them, I really don't find that there's a huge, I'm not super picky about that one either. With
Okay.
some of these spore-based, there's active probiotics and then spore-based, right? Like the
Yeah.
active cultures. With some of the spore-based ones, it seems, I don't have any like research, but it just seems that sometimes they're best taken with food because otherwise people's tummy can get like a little achy quaky sort of thing.
Yeah.
But I don't find that it makes a huge difference if you take them with or without food.
Okay. Let's touch on spore-based probiotics real quick
Mhm.
because I think they're recommended, from my experience and things like SIBO and that. Could you talk about what the difference is between spore-based probiotics? Because I really think that would benefit the audience because, there's so many different ones and then those are typically recommended, I guess, for certain conditions. So what are the differences and why are they so beneficial for certain conditions or
Yeah.
yeah.
No, and you totally hit the nail on the head there, Kim, right? The spore-based probiotics, I'm typically going to be more interested in working with those if someone has SIBO or if we do a microbiome assessment, like a comprehensive stool analysis, and we find that their good microbes are just like super duper low. In both of those situations, I might be more inclined to reach for a spore-based probiotic, but sometimes I'll do a little like in that ladder where everything is super low. Maybe they've been on antibiotics for a long time, or have a long-standing history of the need for antibiotics. Then I might bring in a combination of spore and active. And the difference being is like our active probiotics, these are the ones that most people are more familiar with. Like if you look at a bottle of probiotics, you'll see 5 billion active cultures, 10 billion, 20 billion, whatever it says, right? And so this means these are active, like quote unquote, live bacteria that are, the good bacteria we want in our body. And so when you swallow them, they go through all of the digestive processes before they reach their final destination where they are intended to live, and that is in your colon. And so these beneficial bacteria, these live microbes, a few things. One is you want a really high quality supplement because not all of them are engineered to make it through the stomach acid and then make it through the pancreatic enzymes and make it through, like all of the different hoops they have to jump through to finally arrive at your colon. Right. So a high quality brand will be sure that the capsule is acid resistant and, just passes all the tests so that it does have the impact we're looking for. But the thing with it is that mostly studies show that those active probiotics, those active bacteria are only giving us benefits when we take them. In other words, they don't stick around, right? They do confer benefits, but when we stop taking them, it's not like we suddenly have like a colony of flourishing bifidobacteria or whatever we've been taking, right? Versus these, and by the way, I will still use them, right? That Akkermansia is an example of an active culture that I am using, right? And so with the spore-based probiotics, those are a little different. It's the bacteria are in different forms. They're kind of like latent little seeds that when they make their way to their, first of all, it's easier for them to survive the digestive mechanisms they need to survive to make it to our colon. And then upon arrival, it's more of a seeding and flowering situation, right? In other words, they actually do have, they've been shown to have a longer term positive benefit on the diversity of our microbiome. A few more things I'd say about that, why we favor those over active probiotics with SIBO is that most people with SIBO will feel worse with a probiotic. And so that's a really good tip for any of you listeners who you're like, oh my gosh, that's me, right? When I take, everybody else feels great. When I take a probiotic, I feel worse. I feel more bloated, or my digestive distress is worse. I'm more constipated. I have more loose stools, whatever your flavor of digestive distress is. If it's worse with a probiotic, you probably have SIBO. And there are a lot of different things you can do to confirm that and address it. But one thing you would be, well served doing is avoiding active probiotics. I don't ever typically, with someone who has SIBO, go straight to a spore-based probiotic. We're going to do
Okay.
more work to first get rid of, just for your listeners,
Mm-hmm.
SIBO stands for small intestinal bacterial overgrowth. And small intestinal bacterial overgrowth is really speaking to the fact that our microbiome, the bacteria that Kim and I are talking about, they're supposed to live in our large intestines, not in our small intestines. But for a variety of reasons, they can, so to speak, swim upstream and make a home in our small intestines. And when that happens, and when that happens in abundance, more than just like a few trickling bacteria, that is small intestinal bacterial overgrowth. So mostly for people who are dealing with that, bloating is going to be one of the top symptoms someone has
Oh my
with
goodness.
SIBO. It's like,
If I could, I mean, so many women struggle with bloating. I mean, I mean,
mm-hmm.
obviously bloating should never be, dismissed. I think a lot of people have that symptom and it's dismissed, and it could be indicative of a more serious condition. So you definitely need to get it ruled out and not just assume that it's fine. But I totally agree with you in bloating. And not only that, if I find that SIBO is pretty difficult to treat, it seems like, people will come to me and they've had that round of antibiotics and it's supposed to be this miracle, but yet they're still struggling. Do you find the same?
100%. Totally spot on, Kim. I mean, there are people who I'm like, okay, just sit back, right?
Yeah.
It's going to be, we're in this for 6-8 months of like pretty intensive treatment. And by pretty intensive, I mean, we're going to be making dietary modifications. You're going to be taking a variety of antimicrobial supplements. I do use only natural interventions. My reasoning for that is multiple, but one of them is that we're going to be less likely to harm the good bugs and more likely to just pull out the bad bugs as opposed to impacting both. And they also work, right? But it does require some patience, some diligence. But the cool thing is, I'm thinking of a woman who, she was a great example. Not only did she have SIBO, she also had a parasite, which was a stinker, right? So we worked together, and over the course of our work, right, we did this cycling of antimicrobials because sometimes it's helpful to sit back and let the bugs come out so then you can lambaste them again. And that's, kind of what we were doing. So over the course of our work, she needed some support with HCl, stomach acid, so to speak. And fast forward, she reached out to me about 4 weeks ago and she said, I've been having like, it almost feels like chest pains. And I mean, she's like I think she's early 30s. And I mean, picture of good health otherwise, right?
Yeah.
And so we hopped in the call and we started talking, and it was like, oh, you don't need HCl anymore. Huh. So her body had healed to the point where not only was she, she had been done with her SIBO treatment and had been symptom free from a digestive standpoint for quite some time, but she also reached the point where she no longer needed the HCl, whereas at one point she really did.
Okay. What would be, like in general, stomach acid typically declines as we age. How would somebody know they need stomach acid support? Because it seems like everybody is thrown on Pepcid or, these, PPI, proton pump inhibitors saying you have high acid, but in my experience, it's quite the opposite. Could you explain that a little bit?
Yeah, I mean, it can be a tricky thing. One is when I do a comprehensive microbiome assessment, we get a peek at this. It's not the holy grail, but we get some information on whether someone is digesting protein well. And that is what stomach acid is a superstar at, digesting protein. So it can show up there, but it doesn't always show up there, right? Sometimes it really is just trial and error. Sometimes it is, take it. Do you notice a difference? No difference? Okay, take more, right? I mean, there are people who I will have taking, 8 with meals. And then also there are some people who they do take it and they're like, oh my goodness, like heartburn galore. Okay, not your solution. That's actually not your problem. So
Okay.
unfortunately, it can be an instance of trial and error.
Yeah, makes sense. But
Mm-hmm.
with the natural antimicrobials, typically I think that's going to take a couple months,
For
right? To start
sure.
really working.
Yes,
Yeah.
absolutely.
Okay.
Absolutely. Yeah.
Yeah.
Yeah. Yeah. A couple of
Okay.
months using multiple rounds. And yeah, again, when people have been dealing with this, especially for a long time, like you said, that SIBO is just can just be a real stinker. And so, just staying with those antimicrobials for some time is needed.
Well, I feel like the low FODMAP diet is typically the recommendation, but
Mhm.
patients seem to have a really hard time
Oh my
sticking with
gosh.
that. So I wonder, it's hard because to really see if it's being effective, it's hard because they find it so difficult to follow.
Yeah, it is I mean, I do everything I can to not recommend that, right? Which is just to say, I hate it for them as much as they hate it for them. Maybe they probably hate it more, but
Yeah. Yeah.
but it really, I mean, it's like turning yourself into like a Cirque du Soleil performer every time you sit down to eat. Like, oh my God, right?
Right.
But
Yeah.
oftentimes we can just come up with, okay, I have people do symptom and nutrition tracking, and so it's common that it's not every high FODMAP food. It's
Mm.
just a few select ones that are like the real stinkers for that person. So we'll pull those out, and that usually does the trick. There are absolutely times I can think of two people in particular where I was like, I'm very, very sorry.
Yeah.
But, and they were sports and it was needed. And, I always let people know, listen, my wish for you is to be able to tolerate as varied a nutrient dense diet as you can and feel great. Right. So just know, like, I have no interest in you staying on a low FODMAP diet for the rest of your life.
Right.
That just sounds awful.
Yeah. But people do lose weight on it when they are consistent. It's amazing because I mean, really, you are getting rid of a lot of stuff that's not great for you
Right.
anyway, right?
Yes. Yeah. Yeah.
So,
Yeah. Yeah. Absolutely. Absolutely. It is true. And it's probably, a combination to exactly what you're speaking to, Kim, right? Like you're pulling out a lot of things that are, pro-inflammatory and, going to spike insulin anyway. And, all those things. Right. But also, I would suspect, I don't know for sure, but like, the impact it has on your microbiome, right? We were talking about microbiome and weight, right? So as the microbiome starts to get remodeled, that's probably, just another way that it's helping the scale shift.
right. Yeah. I mean, the microbiome is wild, those stool tests are so interesting to me. You know, Traditional medicine says don't do them. They're all, a scam. But I feel like it provides so much information when people are willing to do it. They're not always wanting to go that route. But the
A
microbiome,
hundred
it tells us
percent.
so much information. Even like you said about the digestive enzymes and their ability, and do you need them? And looking at stuff like estrogen metabolism, which is huge for women,
Yes.
estrobiome or however pronounce it, but just
Yeah.
getting making sure we're having healthy metabolism of our estrogen is really important and can be shown on a microbiome test as well. um, so yeah, I want to talk with you a little bit more about weight loss because I think that's a lot of what you do, right? What are some of the 5 essentials essentially of weight loss mastery, and do you believe that everyone should be aware of?
Well, so with regards to the five essentials to weight loss mastery, just know, like, for your audience here, I'm talking about how you're relating to your health, your body, yourself. And when I work with people, we always bring in the science. So I like to say I take a data driven, heart centered approach because we're human beings, right?
Right.
And if we were computers, we would only look at the data, but thank the heavens we're not. I'm
Right.
quite happy being a human. I'm sure you are
Yeah.
too, Kim.
Yeah.
So when I think about the five essentials of weight loss mastery, the first one is cultivating the capacity to be kind and honest, both kind and honest. And, commonly for people who have struggled with their weight for years or decades, they've been really skilled at one or the other and probably at different times, right? So probably bounce back and forth a little bit, right? So oftentimes when I work with people, they're so just kind of spent with the broken approach that, maybe they haven't stepped on the scale for months or years, right? Because that's their way of being kind, right? Because in the past, when they were honest, it was like, okay, now let's pull out the whipping post and beat myself up for, feeling a failure, so to speak, right? But there is a place of arriving where you grow the capacity to be both kind and honest and bring them both to the moment and use your truth as an opportunity to learn, whether it's the number on the scale and it's something you're glad you're seeing, still let's learn from it, right? Like what's at the source of that? Let's get curious about what worked. And then on the flip side, if you look at the scale and you don't like what you see, let's also learn from that, right? Is there anything you can see that led to that? And if you can't, then it's even more important to go get some labs done and figure out what's the source. If you're like, listen, I really have no idea, then it's time to really dig in and look deeper at that. The second essential of weight loss mastery is getting related to the truth that you're always saying no to something, right? So oftentimes in the moment when people are making shifts, and in particular in the area of nutrition, whether that's around food or alcohol, it's easy for people to be caught up in a sense of like, they've been living in this deprivation overindulgence. So immediately when they consider saying no, they're struck with all of, how badly they want it, or like, oh, but I didn't want to say no. And the point is like, not that you can't have a cookie or a glass of wine or two, right? That's not the point. The point is really just to be present to the truth that when you say yes to the third or fourth glass of wine, you're saying no to health outcomes you care about.
Right.
When you say yes to the fifth or sixth cookie, you're saying no to health outcomes you care about. Right. So really just getting clear that you are always saying no to something, and you want to be intentional about your no's. And again, that is not designed to leave people with a sense of like, okay, I got to be perfect, because that's not the game we play here at all, right? But just really being thoughtful in what you're choosing. The third essential of weight loss mastery is really getting clear on your vision of vitality for your health in your life. And this is an exercise I work with people on that is designed to leave people with an authored intention, a self-authored intention for their health in their life. Because I found that we don't buy what we do, we buy why we do it. We don't buy what we do, we buy why we do it. And so, for your listeners, if you were to kind of time travel to the 5-year future and envision this future where you're thriving, where your health and vitality is as you intend and desire they occur, I want you to take a moment to actually write down what that is for you. What is that like? What's that like for you to move about the world and, get dressed in the morning? And how do you relate to yourself? What becomes available? Because simply put, you're showing up differently for yourself and others. That's the beginnings of authoring your vision of vitality. And I really, really invite everyone to take that on. And as you do it, do it in first person present tense, right? So I am 47, so I'd say I'm 52 and my body is strong and beautiful and resilient, right? And I'd say whatever else I want to say there. I move about the world with ease and confidence and deeply connected to others, right? So you're really painting this beautiful picture of your intended 5-year future. Number 4 is really getting that willpower is one tool. And in your health journey, you're going to gather a whole toolkit. Willpower is one tool, but it's a very delicate tool. And so if you're always leaning on willpower, the predictable future is it's going to break, right? And so, just knowing that you're going to need to get tooled up such that your, what you reach for is way, way, way more than willpower, right? You're starting to look at your environment and what calls for you to live aligned with your intention. You're starting to look at how you plan your days, your weeks, right? It's a lot of different things. And this does not happen overnight, but just simply starting with the awareness that, mostly in this old broken paradigm, you've been handed one tool, willpower, and it's delicate and it breaks easily. And then you feel a failure. And it's really because you weren't handed a toolkit. Like there is a toolkit you will develop over time. And then, the fifth one is really working with someone who is not just a listening for your intended future, but really is skillful in guiding you. Kim, myself, there are plenty of others who are wonderfully skilled, and really just finding the right person to guide you and your health journey. I think about it like the game of tennis. If I really wanted to excel at the game of tennis, I would get someone who knew a lot about tennis to guide me. And that's who you are in this area of life. That's who I am in this area of life. And then there are lots of others in this world who are very well skilled to guide you as well.
Yeah. And I think for women, I think what I hear from, some of my patients is breaking that negative relationship with food, or, they were raised in a home where the mom was always having to have low fat, or, there's this associations with food that they bring into their own life, so, a lot of that relationship and breaking free of that and starting to see food differently, it's,
Yes,
yeah, and it is, because it is ingrained in you, and women tend to feel a lot of shame and things around food and self-sabotage, and it's really working through some of those things psychologically, actually, to have better relationship with surrounding food, and seeing it more as something it can do for your body to make it strong and make it healthy, and just viewing it more positively as opposed to what you can't have and you shouldn't have, and all of these negative, words and thoughts surrounding food. So it sounds to me like this whole 5 essentials is, incorporating all of those things into, more healthy view of relationship with food in your body and love for yourself, and working towards a stronger, healthier, happier future. Right.
definitely. Definitely. There's a lot of healing that happens, and I'm sure you get this too, Kim. I'm thinking of a woman who last week, I give people, I call them fulfillment exercises. We could also call them homework. But, I had this woman read a blog, and it's on this term called ahimsa, and it's from the Buddhist philosophy. And ahimsa means nonviolence. And so it's really a very brief blog that is looking at nonviolence
Mm,
and how we do violence unintentionally, in particular to ourselves in the area of health, right? And so it's one of the ways, being able to see old patterns that were born of violence and self-aggression is one of the ways we can start to heal those old weight wounds. And it does take time. And one of the things this woman said to me, she was like, "Oh my gosh, this is so powerful. And it's not what I thought I'd be doing." Like she thought
right.
she right. It's like, no, this is the journey, right?
Yeah.
This is the healing journey. And it does, it takes grace, and it takes compassion, and it takes courage.
Right, definitely. And it's more than just, cutting out bad food. There's so much more that goes into it. And just I love looking at it more of like a healing experience,
Yeah.
and yeah, it's just more, you feel more at peace with that, and more working toward a healthier viewpoint and body at the same time. So definitely. I want to talk a little bit about what you've talked about for the 3 overlooked causes of slow metabolism, because I think that we can get this wrong as women in ways of like food restriction and over restriction. And so if you could just talk about maybe those root causes of slow metabolism, I think that'd be really helpful.
Yeah, yeah. Well, first of all, I will say what I'm pretty sure you would say too, Kim, is that I hate to break it to your listeners, but it's not your thyroid.
Yeah, that is,
Right.
yeah. In
Or at
fact,
least it's not owned.
they're so disappointed when the thyroid comes back normal. It's like, what? It had to be that, right?
Right, exactly, exactly. It's kind of funny. It's comical, right? But I
Yes.
get it, right? Because people are like they're pulling their hair out, and the only thing they've been told is like your thyroid's in charge of your metabolism. So if you have a slow metabolism, it's your thyroid, and if it's not, then sorry, right?
Right,
But that's
exactly.
definitely not true. That's definitely not true. And to expand on what I know Kim would say, what you would say as well is like, okay, it's not your thyroid, and of course, yes, we need your thyroid functioning optimally.
Right.
So when I work with someone on weight, we are going to check your thyroid every which way from Sunday, right?
Right.
We're not just going to do a simple TSH. We're going to look at a lot of different factors related to your
Mhm.
thyroid health, and we're going to support it so that it's at its optimal function. But even if your thyroid is in need of support, I've never yet found it to be the only source of a slow metabolism. In other words, it's not like, thyroid needs support, fix it, you're done, right? There's
Right.
always something else. And, three of the commonly overlooked causes are: one is elevated inflammation,
Mhm.
and, in particular, elevated chronic long-term inflammation, right? Our body is supposed to have a short-term inflammatory process. When someone is sick or injured, that inflammation is there to help, right? It actually facilitates the healing process. But for a variety of reasons, the body can get locked into this long-term or chronic inflammatory state. And one of the unfortunate side effects of this is that your body gets pushed into fat storage mode, to slow metabolism mode. And, we don't need to guess this, we can actually measure it, right? So there are different ways we can measure inflammation, but two of the ways I commonly measure, and sometimes I do more than this, one is HSCRP and the other one is homocysteine. So these two are things I'm measuring on really just about anyone I work with for different reasons, for different conditions, but certainly in the area of weight, we are looking at that inflammation. And the cool thing is if it's elevated, it's almost like predictable. I'm like, okay, just hold on a second. It's going to take us, first we're going to need to knock down this inflammation, and then you're going to see the scale move, right? So it'll be like 2, 3, 4, 5, 6, 7 weeks. And people are like, oh my God. And then all of a sudden it's like, boom, 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 boom. The scale starts to move because their physiology has shifted. It takes time to shift the inertia, break the cycle, shift the inertia of inflammation. If it's especially high, right? If it's up above 3.5, anything above 1.5 is high, but above 3.5, it's going to really take a second to bring that down.
Right. What I have patients that it's extremely hard to get that down. Like
I do
point
too. I do
five,
too, Kim.
15.
Yes,
I
I do too. I really, I don't, I wish I could say it's like, just like, I wish I could say just use the acromencia or something like that, right?
Right.
But there are definitely some people who it's really, really sticky with. I mean, we just have a lot more to learn, fundamentally speaking, but,
Because they're doing the omega-3s. They're doing, they're trying to eat more healthy foods, they're trying to sleep, they're trying to
yes.
exercise. And I check
Mhm.
it and it's either gone up
Yes.
or gone nowhere. And it's so frustrating for
A
them,
hundred percent, a
you
hundred
know?
percent. Yeah, no, I totally get it. Mostly I see it move, but there are definitely, I can think of two people, no, yeah, two people in particular who, it's like pull my hair out, like, oh my gosh, why is this not moving? You are doing so many things well.
Right.
And
Yeah.
sometimes we encounter those conundrums, unfortunately, but it definitely is a key. It's definitely one of those things that we gotta get under wraps to help the
Right.
body lose weight.
Right.
Um,
And that's the thing. The extra weight isn't helping that level of inflammation
right.
either. So
Yes,
that's so frustrating,
exactly.
you know?
Yes,
Wow.
it is. The
So
extra weight itself is pro-inflammatory.
yeah. So what would
Mhm.
number 2 be?
Number two is suboptimal insulin sensitivity. And we kind of talked about this before, right? That the range on labs goes up to like 22, 23. And where we really want to see it is at 7 or less. right? And so when it's starting to creep up, that suboptimal or decreased insulin sensitivity means that your cells aren't hearing the message of insulin. And so your pancreas produces more insulin, which all sounds great, except that besides, as it pertains to those cells, what insulin does is, knocks on the cell door so that cells absorb glucose. But when your body has to produce more insulin, the other thing that gets amplified is its regulation over metabolism, which is fundamentally to slow it down. So insulin is going to communicate to your body, you've been fed, store it away for a rainy day. Do not burn that fuel, right? And so the more insulin we produce, the more that message of store, store, store is going to be amplified.
Right. And from my experience, from what I've read, having an insulin, I think around 8 or 9 increases your risk for prediabetes
Totally.
and
Yes.
onward. So
Yeah.
that's an
Cardiovascular
important to think about.
disease. Yeah.
And what
Yeah.
I'm finding in my menopausal women is they are trying everything, but yet their hemoglobin A1C is still getting to that 5.7 or above range,
Mhm.
and that pre-diabetic range, when medical research is really not saying start medications, do anything really about it. But to me, no, that's the perfect time to intervene with something.
Absolutely.
You've got to get more serious. If you're pre-diabetic, if you're in that 5.7 range, it's time to get more serious
Right.
because
The thing to do is to not wait till you're diabetic, right? The thing to do is
exactly.
to turn the ship around.
Right, right.
You're going the wrong way, you
Right.
know?
And with menopause, the lower estrogen levels changes the way insulin works. So it's
Yeah.
already working against us
Yeah,
as we
yeah.
lose estrogen. And we do have an increased risk of type 2 diabetes and metabolic
Mhm.
syndrome and cardiovascular and insulin resistance. So all of these things. So that is why it is so important to really be more aggressive when it's getting to that point for sure.
Yeah,
Some of your
definitely.
favorite tools for insulin resistance or
Well,
increased insulin?
yeah, I mean, some of the things we talked about, right? That hitting that berberine hard,
Yeah.
bringing in the akkermansia, bringing in making sure omega-3 fatty acids are in optimal ranges, vitamin D. Those are definitely some really powerful points of leverage for improving insulin sensitivity. Mhm.
Okay. Yeah. I'm so glad you talked to me about the acromancy. I'm going to add that one in more because like I said, I wasn't sure if it was all hype or
Yeah.
really effective. So I'm super excited to have one more thing in the toolbox to use. So awesome. What's number 3?
Number 3, it's detox pathways. I like to say gunked up. I know, very technical term, but detox pathways gunked up. And what I mean by that is, detoxification, right? It's a term we kind of use cavalierly these days, right? And I often think, I'm like, oh, if you just put detox on a supplement and it will go gangbusters, right? Everybody loves a good detox supplement. But detoxification, there are many mechanisms involved in detoxification. And these mechanisms are also called pathways. They either can be not working well, right? It's like you've got like a rusty machine that's just not working very well. And that may be because of nutrient deficiencies, or they might just be overwhelmed, right? Like there are just too many toxins they're trying to process. And that can be, like there are a lot, that's a whole other different conversation. But in either of those situations, the end product, there are a few things that lead this to having an impact on metabolism. One is it's going to cause more inflammation, right? Because there's going to be backup in these detox pathways, which in and of itself is inflammatory. 2 is it's going to lead to altered estrogen metabolism because, while we typically think of pollutants or, pesticides or parabens when we think about our detox pathways, our hormones go through our detox pathways too.
Right.
So, when those are all gunked up there, then it's going to affect our estrogen metabolism. And certainly that's going to have an effect on our metabolism and the weight too. It's going to, decrease satiety. It's going to slow down our metabolism and have like a double whammy there.
So some of the symptoms that people might be experiencing that maybe their detox pathways are gunked up might be what? Fatigue, joint pain, maybe constipation. What other
Yeah.
things?
Well, to your point, Kim, that constipation, I would say, is like a red flag for, okay, your detox pathways are gunked up, right? Because I love the saying, I didn't make it up. I wish I could say I did, but we're not just what we eat, we're what we don't excrete, right? Meaning that if we are not having healthy bowel movements, we are reabsorbing toxins. Our bowel movements is one of the ways our toxins get out of our body. Urine is another. Those are the top two exit strategies. And then we have our breath and our sweat. But if we're only pooping a couple of days a week, well, that is a problem as it pertains to toxins.
Right. I know. I think this a detox can be, you know, our body typically has its own way of detoxing, like you just mentioned. So in traditional medicine, they say, it's a red flag if anybody's talking about doing a detox or talking about toxins. But truly, I think our body really does have issues with that. And it's not that we have to go do all these detox things that's not necessarily going to work. And maybe that part might not be, you know, all the different detox things that are sold. I'm just saying helping your own body work better.
100%. I'm
Yeah.
totally on board with you, Kim. I'm not a
Yeah.
big promoter of like, oh, you got to detox twice a year or things like that. It's like,
Right.
no, let's see where we can reduce the amount of toxins we need to process and see where we can just make sure those pathways, those detox mechanisms are running smoothly
Right. So the
and then
fiber,
exiting the body.
right. So
Mm-hmm.
increasing fiber and
Mm-hmm.
exercising and sweating
Mm-hmm.
and maybe
Mm-hmm.
making sure we're breathing normally, deep
Yeah.
breathing and those mechanisms
Yeah,
as
totally.
well.
Well, and
Yeah.
also, with those different those mechanisms or pathways, each of those phases need different support. The
Mm,
enzymes involved need different support. They need B vitamins, they need some antioxidants,
mhm.
they need amino acids, the building blocks of protein, right? So, if I work with someone and they're not, they're getting 20, 30 grams of protein a day. It's like, okay, well, your detox pathways need some support. And we're gonna get to work on that simply by increasing your protein on a daily basis because your body needs it, not just for your detox pathways, but for an abundance of other things.
Ah, right. I know I was talking to another lady the other day, and she was saying most of the time we don't eat enough. And that's
Yeah.
part of the problem. As women, we're
Yeah.
not eating enough at one setting, getting the protein, the fiber, and the nutrients. So that leads to more cravings and poor choices and snacking. And so making sure we're
Mhm.
actually eating more than what we think we need to be eating is probably better than the other. Let's just touch on real quick, and I don't know if you have any favorite, adaptogens or women in perimenopause, and menopause as maybe our estrogen decreases, our cortisol, our stress hormone is increasing. Our bodies become less tolerant to the effects of stress, and maybe we have more symptoms of that, and even related to weight gain as well. Do you have any favorite adaptogens that you recommend for women during this time? And then also, can adaptogens, do you really have to take just one at a time for a while and then add another one? Or can you combine them? And I know this is a lot of questions, but are there ones that are better in the morning to help wake you up and then some at night that help put you to sleep? So if you can remember all that.
Yeah, 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 yeah. Well, I like different adaptogens for different things.
Hmm.
So I think about, in particular, I mostly think about sex hormones, like adaptogens that would be useful for balancing sex hormones, adaptogens that would be useful for balancing our adrenals. And those, by the way, will have some spiral up benefits as it pertains to thyroid function. In adrenals, right, that cortisol, our primary stress hormone that our adrenals produce, for some people, we'll need to give it a boost. And for other people, we'll need to tap it down. And just like you were saying, Kim, for some people, it's different things at different times of day. Right. But I'm always going to go at it first with lifestyle and nutrition, and making sure their foundational nutrients are in optimal ranges. Sometimes, as it pertains to adrenal support, we really just like, their B vitamins are in the toilet. And so we need to bring back those B vitamins so that, which is really nourishing for the adrenals as well. And then that just kind of handles it. So sometimes that's the case, right? But if I think about, okay, what adaptogens do I like for different things? I really like, for female sex hormones, I really like maca, and I really like one specific brand of maca. It's really the only one I use, and I do not have a financial interest in this company. The product itself is called Feminescence Pro, and they make, Feminescence Pro. And they make different versions depending on, okay, are you a cycling female who gets your period? Are you perimenopausal, like you're just starting to go through the changes? Or are you postmenopausal? You're actually in menopause, your period's in your rearview mirror for at least a year, right? Okay. So they have 3 different forms. Okay. And why I like them is they work. I mean, they just work so well. They work on managing hormonal symptoms. They work on, if someone's dealing with hot flashes and the like, they work there. They also, incidentally, the postmenopausal one has some benefits as it relates to heart health and bone density as well. And, in the way of like dosing it, I want to say for all 3 of them, the maximum dose is two times a day. Mostly, I find people doing just fine with anywhere from 1 to 2 in the morning. I mostly don't see a lot of people needing more. Sometimes they do, but I'm kind of like a less is more kind of a gal. And so, especially for someone who knows that their body is quick to respond or is a little more sensitive, start with the least amount. Just start there and hold it there. You could hold it there for a couple of weeks. You could even hold it there a month before you bump it up to see if, I typically go 1. And then if they need a little more support, I may go 1 and 1. So 1 in the morning, 1 in the afternoon, and then I might bump it up 2 and 1 and 2 and 2, like that. But it really, those Feminescence Pro products are pretty darn awesome.
Are they capsules?
Yeah, they're capsules.
Capsules.
Mm-hmm. They're capsules, and you can even get them at Whole Foods. Whole Foods. Okay. They have them as well. I want to say, I'm trying to think of, sometimes, they have like the practitioner name and the retail name. I think it's still Feminescence Pro, but you can find it on Amazon. So yeah.
Can you take maca if you're doing hormone therapy, bioidentical hormone therapy?
I believe so.
Okay.
I am trying to, mostly I don't find that people have a need for it if they're doing hormone replacement therapy. Don't quote me on that, but I can't think of any reason why you wouldn't be able to, because it's not adding hormones to your body. It's just kind of greasing the wheels so that the communication flows a little more smoothly and your body self-regulates.
With maca, does it impact your thyroid function negatively?
I know there's that.
Because
I don't really see that.
I
know, like that in cruciferous vegetables, right? But I just don't really see it holding water in clinical practice. I haven't really seen it being a problem for people.
Okay. Because I feel like I remember taking it, but it might have been the time of my stages I was at and feeling like more tired with it. That's why I've been scared to try it again. I'm like, but maybe I'll try the other. And see.
See how it works for you. So that as it pertains to sex hormones. And I guess the other things that I think about is mental acuity and immune system, right? And then I start to think more about our mushrooms for those guys. Mental acuity, I think about lion's mane. Immune support, I start to think a little bit about reishi or cordyceps. And then with regards to supporting the adrenals, I mean, everybody loves ashwagandha. Ashwagandha is kind of like a very gentle, works for a lot of different things. Adaptogen, right? It doesn't add any cortisol to the system. It just helps your adrenals be a little more balanced. So I would feel comfortable using that for any, someone in any situation. I might find one that like a supplement that combines it If someone seems a little more high cortisol, like in that world, a little extra anxious, difficulty sleeping, stuff like that, I might find it so when it's in combination with something like a lemon balm, something that's like a little bit calming, maybe a little lavender, something like that, versus when they're looking for a little more boost in energy, I might want to see it combined with something like licorice. And maybe even going a little bit heavier with those B vitamins and some C. But ashwagandha, 600 milligrams up to twice a day. And similarly, oftentimes it's like once a day is going to be just fine. So I always encourage people, start with the lower dose, see if it gets you what you need. If you need more, you can always take more. But more is not always better. Sometimes you don't need more. And then there are things like Schisandra. I love Schisandra. Schisandra has some nice benefits as it pertains to adrenal support and just kind of like similar to ashwagandha, kind of anything either side goes sort of thing. It also has some benefits related to constipation. So sometimes it can be a 1-2 punch for someone who has like really stubborn constipation and also could use a little adrenal support. I might reach for something with Schisandra in it. There is something called liver detox, I want to say it's called, by Protocol for Life, that has some Schisandra in it and a little bit of N-acetylcysteine and a little bit of milk thistle. And it's just kind of like a nice combination. That can be, it's called liver detox, but it really does a lot more than that. And similarly with, speaking to the sometimes a low dose is all you need, I want to say the daily dose for that is 3 a day. Most people 1 a day is just fine. They do just fine with 1 a day.
Do you take that with food or without food?
Typically with food, with breakfast usually. Mm-hmm.
Okay. Just want to make sure.
Yeah.
Because people ask, and I feel like supplement, they never really say,
It depends. The fat soluble ones like vitamin D or omegas, you always want to take those with food.
Those are,
And then the antimicrobials, those are often ideally away from food. I like to use, if I'm using magnesium citrate. Oh, speaking about the end of the day when we want to like kind of bring cortisol levels down, sometimes all people need is magnesium. I joke is the gateway supplement because it does so many amazing, right? I mean, like, is there anything magnesium
But what's
can't
your
do?
favorite one for like
It depends
night?
on the person, right? So if someone is like, has multiple bowel movements a day, I'm not going to give them magnesium citrate because then they're going to be on the toilet all day long, right? So if someone's constipated, I'm going to use magnesium citrate. If someone has healthy bowel movements, I'll grab magnesium glycinate because it's going to be less likely to impact their bowel movements frequency. And then if someone has some difficulty concentrating or really has heightened stress, I will grab magnesium threonate, sometimes called Neuromag. That Neuromag is nice. And there are a lot of different Neuromag supplements out there, that magnesium L-threonate. Some of them are crazy expensive. And quite frankly, Kim, I don't know why. So what is the company? Life Extension, again, no financial interest, but they have one that's pretty reasonably priced. But I will say the magnesium glycinate is a lot less expensive even still. So if someone's like totally fine on that front, then I'll just go for the less expensive of the two.
Do the threonate, I was thinking for sleep quality, do you take the Neuromag at night?
Yep. Whether it's the Neuromag or the magnesium glycinate or the citrate, that is something I do like people taking away from other supplements and away from food just to maximize absorption.
And do you combine, can you combine these threonate and glycinate, or do you take one
you
or the
could.
other?
Yeah, you could if you felt like a combo was useful. I think in that situation, I'd probably, a few different places where I might find that useful, right? If I test their red blood cell magnesium, red blood cell, and it's super low, if it's under 5, I would call that super low to me. Then I might be bringing in magnesium more than once a day. So evening and in the morning. And I might, if they have, like, okay, I want to be able to focus better, or, like something like that, I might do both threonate and glycinate. Or if they're constipated and their magnesium super low and, there's focus concerns, then I might do citrate and threonate, that neuromag. I was going to say something else about that. But yeah, I don't get too, with magnesium, it's hard to push it too high, but you can, right? Yeah. You can. Like, there are times where I see people with, like, they've just been self-supplementing and they come in, their magnesium super high. And I'm like, listen, now this is actually a little bit of a health concern. So we got to tap the brakes here a bit.
Yeah. I see that with B12 a lot. A lot of people's B12 is elevated.
Yeah.
Supplementing. So, well, thank you so much. My last question would be, I kind of ask all of my guests this. So if you had a giant billboard that all women, maybe midlife and menopausal women, would see, what would you want that billboard to say? What would you want them to know?
I would want it to say, what is your best game right now? What is your best game right now? And really, what I would want people to be getting is, what is my best game right now, right? And by best game, I mean, what is the most self-honoring action I could take right now? And if you are asking that question and answering it in earnest, your wisdom will lead the way, right? Because the answer might be having a glass of wine. The answer might be having a salad with salmon. The answer might be getting more sleep instead of getting up to work out, right? So you really want to be situational and get clear on what is the most self-honoring, what is the best game you can play right now.
I love that. I find that what you just said is so important. I feel like as I've gotten older, I have so much more grace. I don't feel like I've got to get up. I've got to do this. I've got to do that. It's like, no, maybe I needed to sleep in a little bit today. And maybe that was my act of self-love for the day. And you know what? It's fine. I'm fine, right? Like letting go of these expectations of us that no longer serve us and just giving ourselves more grace and love. So I think you're so right. That's wonderful. Well, how can everybody find you, follow you, learn more about your practice?
Yeah, well, you can find me at wellempowered.com, and a few different ways we can connect. One is, if you'd like to sign up for our email, we send out weekly dares, which are fun little micro habits that you can begin practicing. And also, if you'd like to explore working together, please schedule a complimentary consultation and make sure you let me know Kim sent you, because you will be gifted with 10% off if you decide to work together. And then on Instagram at wellempowered, I really do my best to make sure that what we're putting out there is really of value. And hopefully you find something in there that's a contribution to you in your journey.
Awesome. Well, thank you so much for being here. I have learned so much from you, and I'm sure everybody else has too. So thank you so much for your time.
Thank you, Kim. It's been such a treat.